Hi everyone, my name is Carolyn Savage from ConnectWell Lung Health and Rehab Program, and I'm going to be talking today about asthma treatments, the third education session in the series of 4. So asthma treatments can be varied. It includes often inhalers that can help manage the swelling that is happening inside the airways. A bigger part of that is really education on knowing what is asthma, what your triggers are, and in controlling and managing those environmental factors if you can, which we talked about in Module 2. Inhalers often include short-acting bronchodilators, inhaled steroids of some kind, and other therapies over time. Reliever inhalers or quick-acting, short-acting bronchodilators are often a big part of treatment, really because in the moment of bad breathing or breathing flare-ups of cough, shortness of breath, chest tightness, wheezing, they are sometimes the only thing that can help the airways open quickly. So they work by relaxing the muscles around the breathing tubes as a way to open them. They are not something that should be used every day. And the current guidelines for asthma don't recommend having only this style of puffer within to help manage asthma within your toolbox of medications. So having the reliever is very important as a helper medication, but not on their own and certainly not to be used every day. Regular use of this inhaler really means using it more than 3 times a week or more. Often this inhaler can be used and should be used with a chamber or a breathing medication holding tube in certain styles of puffers. So if you have only this puffer and you use it 3 times a week or more to help ease your breathing symptoms, I'd encourage you to please go talk to your healthcare provider and make sure you have those breathing assessments done and talk about other options to help ease your breathing. A big part of asthma management, of course, is treating that swelling within the airway. So often there's an everyday puffer that's used, even when you're feeling well, as a way to prevent symptoms from happening suddenly and really prevent the swelling inside the airways from causing lots of symptoms, but also potentially closing the airways if the swelling gets too significant. So there's different classes of medications, with the biggest one being the inhaled corticosteroid. So again, an anti-inflammatory for that airway swelling, and or combination inhalers. Sometimes these are called controller or preventer inhalers. So the inhaled corticosteroid puffers is really the cornerstone treatment to treat swelling in the airway. So again, a bigger part of that, of course, is making sure your environmental controls are in place. You know your asthma triggers and you're managing them well. But we know with asthma, there can be swelling in the airways at all times, sometimes really significant swelling. So the inhaled steroid puffers are really meant to treat that swelling every day, even when you don't feel symptoms, but also prevent that swelling from becoming significant in the lungs and causing lots of symptoms. As you see from the image below, there certainly are lots of styles and devices that this class of medication comes in. Some are powdered, some are aerosol, some are once a day, some are twice a day. And how it's determined as to what dose you use, but more importantly, which puffer is right for you, really depends on how busy your lifestyle is. So could you remember twice a day dosing, or if you prefer one style over the other to make it easy for you to use. Usually the side effect of this inhaler can be hoarse voice or sore throat. And because it's an inhaled steroid, treating the lungs directly, it does need to pass through the mouth. So sometimes if yeast infection can happen, make sure you really rinse and spit rinse out your mouth after using this puffer. Use your chamber on the end of the puffers if one is indicated, and really make sure you have a good routine using them every day so that they work at their best. Another class of medication which may come with asthma treatment is called a long-acting bronchodilator. These, however, should never be used alone. They are often only added to the inhaled corticosteroid. How these medications work is really to, in a separate way, open the airways by relaxing those muscles around the airways, around the breathing tubes. So as a different way to open them, they are never indicated for children under age 12, only for adults, and again, never on their own. Side effects can include some shakiness or dizziness that can happen. Certainly, if you have only these inhalers and you have a history of asthma, please talk to your healthcare provider about other options and make sure that you're on the right treatment. Combination inhalers are important part. So often for adults with asthma, if the inhaled steroid puffer isn't strong enough to keep the symptoms under control, a combination inhaler is then started. And again, this is a combination of the inhaled steroid treatment, but also the long-acting bronchodilator. So again, two ways to keep the airways as open as possible and the breathing symptoms easy. Side effects again, sore throat, hoarse voice, sometimes feeling like your heart's beating faster. And again, these inhalers come in very different styles, once a day or twice a day dosing. How to determine which is best for you is really which one is the easiest for you to use and remember to use. The most important way to keep asthma stable is making sure you use your inhaler treatments exactly like they're prescribed. So everyday dosing for that long-acting steroid or bronchodilator, making sure you have the proper technique in order to get that medication deep in the airways for it to work. And using a chamber, of course, if you need to with the certain types of inhalers. There are several respiratory educators within Ontario who can help you to determine if you're using your inhalers correctly or talk about ways to minimize side effects if you have them. Please connect with your healthcare provider or respiratory therapist or respiratory educator to talk about your puffers if you need a refresher on how to use them. An add-on treatment for asthma can sometimes be the leukotriene receptor antagonist. So these are pills, with the most common being seen in the image in front of you, which work to prevent the body from developing some of the swelling that can happen. It's not a steroid at all. Often it can help actually to minimize sometimes that runny nose symptom or some of the cough that can come with upper airway symptoms. Often there's very few side effects, such as headache, sometimes mood changes. And again, this is not the right treatment for everybody with asthma. So you may not be familiar with these, but it is or may be added on to inhaler therapy if needed. And certainly when we think about asthma, and some people, asthma can be very severe, meaning asthma symptoms are very difficult to control with inhalers alone, or even with the right inhalers, flare-ups of breathing symptoms keep happening, keep coming and going. And that's where biologic therapies can be considered. It's a newer type of approach to asthma where often through a respirologist or a lung specialist, the asthma treatment is being very specific to the individual's type of asthma. So there's allergic asthma or eosinophilic asthma. There's blood work that will show what type of asthma you have, and if some of the values within the blood work are high, somebody with asthma may be eligible to try these newer therapies in order to, again, have good quality of life, less symptoms, and easier breathing, not having those big attacks of or flare-ups of breathing symptoms. They do not replace the inhaler therapy, but sometimes the doses of the inhalers can be lowered if somebody is started on the biologic therapy. Often they're given by injection. They're all expensive. So again, through a specialist, often ways are tried to, if you're eligible for these newer therapies, to get some of the drug companies to cover the cost of them. So again, these are only given really through specialist respirology assessments. So talk to your family doctor or nurse practitioner if your asthma is uncontrolled and would like a referral for that. Thank you for joining us on this module. Our next module, our final module in this series, really talks about asthma control and action plans. I hope you can join us.